Hello everyone. Today we are going to start with a pharmacological topic, that is anti-diarrheal medication, for which we should first know what is diarrhea. That is the stool that contains fluid and the fluid weight is more than 200 gram of fluid per day. As from the name we can understand, anti-diarrheal, it is used for the treatment of diarrhea. What it does is it decreases the frequency and severity of diarrhea. That is, it will decrease the fluid quantity in the stool. What happens is peristalsis takes place in small intestine and large intestine. For those who don't know what is peristalsis, that is the movement of the muscles due to which the chyme passes. Chyme, that is our food when it becomes a ball-like structure, it is known as the chyme. When this passes through a muscle due to which the muscle movement should take place, it is known as peristalsis. Then there are causes of diarrhea. There are mainly four causes of diarrhea, that is osmotic, secretory, inflammatory and unstable intestinal motility, or also known as deranged motility. These are the four types of diarrhea. Now I will not tell much about all these causes of diarrhea. I will just explain in short what are they. That is osmotic, because our main topic is anti-diarrheal medication. Our main topic is not about diarrhea. Osmotic, it is the poor absorption of certain molecules. That is, for example, if we take lactose intolerance, for the people who are intolerant to lactose, when they take lactose, the small intestine is unable to do the peristalsis because of the intolerance. So the treatment is just simple: stop intaking of causative product. As example, we have taken lactose. If the person stops taking lactose, then there will be no osmotic diarrhea. It's the simple treatment. Next comes the secretory. What happens? It is caused by the bacterial endotoxins. Example, there is increase of secretion of chloride, bicarbonate, or inhibitions of sodium ions. Due to this, the bacterial endotoxins, mainly the secretory diarrhea, is caused by the bacterial endotoxins. The difference between the secretory and osmotic is the symptoms remain even after decrease of oral intake. In secretory, even after we decrease the product due to which the diarrhea was taking place, then also the symptoms will be there. While in osmotic, this won't be there. If we stop taking the causative product, it will stop completely. Next comes the inflammatory. Inflammatory is an immune mediated damage. For example, inflammatory bowel diseases, for example, we can take like ulcerative diseases, ulcer, or Crohn's disease. The inflammatory bowel diseases and the infection, and from infections like from the rotavirus, salmonella, shigella, or escherichia coli. Then the deranged motility, it is simple: the increased frequency of peristalsis. That is, peristalsis takes place too frequently, due to which the whatever chyme is there, that passes too quickly, which gets formed into liquid, and the quantity of the liquid increases more than 200 gram per day. Here comes the main topic, that is the classification of the anti-diarrheal medication. Supposition a person is having diarrhea, then we can give any three of these classes of anti-diarrheal medication depending upon certain criteria. First one is the absorbents. There are four absorbents, that is the bismuth, cholestyramine, kaolin and pectin. Second is opioids, loperamide and diphenooxylate. Third is anticholinergic, but anticholinergic is not an individual group of antidiarrheal to be given. It is given with combination with diphenooxylate, and the atropine is given in combination with diphenooxylate. Absorbents, what are they? The binds to the diarrhea causing toxins and cannot act on the cells of the gastrointestinal tract. If we know about something about bismuth, then bismuth, it is we can give it with salicylate. It is the antacid for dyspepsia. Usually the people who have diarrhea, some people have diarrhea when they travel. That's not any of the osmotic or secretory. That can be only solved with bismuth. Next is the cholestyramine, that is a little sticky. We can say it is sticky and given as cholesterol lowering agent, binds to the bile and certain bacterial toxins. Kaolin and pectin, these are both derived from a plant and they absorb bacterial toxins and water, and it should be avoided within 2 to 3 hours of other medication. These should not be given within 2 to 3 hours of other medications. Side effects. Side effects of absorbents are ototoxicity, that is unable to hear, then tongue and stool turns black, encephalopathy or Rez syndrome. It is only present when children and the only children who had any infectious disease earlier, and discoloration of and erosion of the teeth if the medicine is kept too long in the mouth. Now something about opioids. Opioids, we studied about two opioids. That is, the first one, it will be the loperamide and the diphenhydroxylate. Both what they do are they stimulate the opioid receptor of the ENS, that is the enteric nervous system. Loperamide decreases the peristalsis. It is also a traveler's chronic diarrhea medicine. And diphenhydroxylate, some penetrate into the CNS, but it is mainly given with anticholinergic because it's an opioid. To decrease the abuse of the opioid, it's given with an anticholinergic, that is atropine. When it is given with anticholinergics, atropine, there are some side effects like dry mouth, blurred vision, sedation, hyperthermia, and urinary retention. So we studied so many drugs and their side effects and how do they work and when they should be given, when they should not be given. Here these should not be given within 2 to 3 hours of other medication. Then the absorbents and even what is diarrhea.